COVID-19 has shown us a pandemic not only is a medical disease, it is also likely to result in a social disease, with lots of insecurities and resistance. Traditional media more and more fail to reach a critical mass of people, whereas what is needed most when it comes to stopping a pandemic is a collective acceptance of safety precautions. So what can be done to overcome people's resistance? Increase the media pressure with the same old messages? Force the people? In West Africa, which has been gripped by multiple Ebola epidemics since 2014, Jerry McCarthy and Paul O'Hagan have developed a different way of communicating with people. Their people-first impact method, in short P-FIM, emphasizes listening to establish trust. But as trivial as listening may sound, listening as the basis of building trust takes a lot of effort, especially if there is no agreement with what we've just heard.
One of the big challenges for organizations, we have wonderful policies, wonderful visions, and yet translating that into real engagement is a challenge. And that's because the importance of listening and trust building is something that we haven't integrated. In P-FIM, we integrate it. It's part of how we do it.
P-FIM has already won wide praise. At a World Health Summit in 2021, the public health experts debated the benefits of community-based communication methods such as P-FIM.
People don't trust the message if they don't trust the messenger. That means if support is needed in communicating with people, and there might be like an outside agency, national or international, arriving at the scene, this agency does not automatically have the trust of the population. The trust needs to be earned.
Dr. Jean-Paul Uulangi, health advisor for Malteser International in the DR Congo, accepted the prestigious Else Kröner-Fresenius Prize, which he received for the public health successes he and his colleagues achieved in fighting Ebola using P-FIM. In the remote areas of DR Congo, Malteser International, an aid organization based in Cologne, has been implementing health projects for many years. But it was only with the help of P-FIM that Dr. Jean-Paul's team was able to tackle epidemic challenges.
L'épidémie d'Ebola, c'est la maladie la plus meurtrière, plus que Covid-19. Et sa létalité, plus de 50%, plus que la létalité de Covid-19 qui est inférieure à 5%. Et pour limiter la propagation de l'épidémie d'Ebola, plusieurs mesures devraient être mises en place, mais ces mesures entrent en conflit avec les habitudes communautaires. C'est comme cela que c'est un grand défi pour nous. Nous n'avons pas voulu imposer des mesures sanitaires à la communauté, mais nous avons décidé d'utiliser une approche P-FIM.
In July 2020, the DR Congo was caught up by the coronavirus as well. Back then, people were already tired of Ebola, and resistance to further restrictions and to vaccinations was spreading. False rumors and conspiracy theories were widespread.
Dieu grand, dans une année, les chercheurs ont fait tout et nous ont trouvé les vaccins. Mais au début, ces vaccins, tout le monde craignait. Et moi-même aussi. Car les rumeurs couraient qu'on allait mourir si on reçoit ces vaccins. Et puis ces vaccins rendront les femmes stériles et ça va tuer les gens de troisième âge, les hypertendus, les sidéens et les diabétiques. Nous tous, on avait peur.
Luckily, Malteser International could quickly apply P-FIM again, and again with the same success.
Dans le cadre des écoutes P-FIM, nous avons briefé nos collègues et nous les avons lancés sur terrain et surtout les membres de la communauté. Et lors de la première session, ils ont d'abord écouté les gens pour les comprendre. Ils ont ensuite écouté tous les groupes des communautés, y compris les leaders et les groupes marginalisés, par exemple les personnes vivant avec handicap. Et de cette façon-là, nous avons pu faire une idée générale des préoccupations qui prévalaient dans chaque communauté. Et ce n'est qu'à la deuxième réunion que nous avons proposé des informations spécifiques, mais aussi des points de vue différents. Et de cette manière-là, une communication bidirectionnelle et de confiance s'est établie, s'est développée entre nous et les membres de la communauté, dans laquelle les communautés et nous, en tant qu'agence comme Malteser, nous avons fixé ensemble l'ordre du jour.
The communication measures were simple, creative and effective. With the help of house visits, radio shows and especially composed songs, as well as posters and flyers, the dangers and the safety measures were communicated in a new way. People now accepted and acted on safety measures. Currently, people are getting vaccinated and preventive measures have become part of their daily life.
Mais avec l'écoute et compréhension de Malteser International, nous avons eu courage de se faire vacciner. Et même il y a des femmes qui étaient enceintes, qui sont venues témoigner, et les CDN ont témoigné, ce n'est pas le cas, on ne peut pas mourir pour ça, le vaccin est très bon. Ils ont leur grossesse qui évolue très bien. Alors à ce moment-là, moi j'ai eu le courage d'aller me vacciner et même j'ai commencé à sensibiliser ma communauté pour que tout le monde ait recevoir le vaccin. Dans mon quartier, tout le monde a déjà eu le vaccin. Je suis très contente que mon quartier m'a compris. Je remercie le Malteser International de nous amener ces vaccins et de faire la compréhension dans chaque communauté. Je suis très contente, je suis heureuse d'avoir les vaccins. Et voilà ma carte de vaccination.
Even the humanitarian organization of the European Union, ECHO, has issued reports and press releases highlighting Malteser International's COVID-19 achievements by applying the P-FIM method. How does P-FIM affect future perspectives in humanitarian work?
We have now evidence that it helps also really to engage people. It's not only for assessments or evaluation, since you can engage them that they help themselves, they become part of the project. Finally, after this approach, a joint operation. That is really a success story, and we will continue to work with this P-FIM approach.
A lot of what agencies do is quite small, and we talk a lot about it. A lot of what communities do is very large, and they say very little. So we want to reverse that, so that they really are at the center of their own development.
Now, what do you think? Could P-FIM also inspire the debate culture in Western countries, where listening to people seems to have been unlearned?